You think you have ADHD or you have been diagnosed with ADHD by a psychiatrist or a mental health professional. Now, let's talk solutions. I'm Dr. Dawny Mathew, a consultant psychiatrist, and this video is about management of adult ADHD. Treatment for ADHD often includes medication which helps balance the brain chemistry and therapy techniques that build skills and coping strategies. The core symptoms of ADHD can be addressed with medication. It may take multiple attempts to find the most suitable medication for you since there are different types available. Stimulants are the most common ADHD medications. They work by increasing the levels of brain chemicals, especially dopamine and norepinephrine, which improve attention and focus, along with reducing hyperactivity and impulsivity. There are two main types of stimulants. Amphetamines like Adderall or dexedrine are potentially stronger and may have longer lasting effects. Another stimulant, methylphenidate, with brand names Ritalin and Concerta, are also widely used. Methylphenidate is available in short-acting, intermediate-acting, and long-acting forms. Short-acting versions work quickly but for a shorter duration, while long-acting versions are more suitable for all-day symptom control. Stimulant medications are frequently prescribed for ADHD, but they carry a significant risk of being misused, abused, or leading to addiction. Individuals without ADHD might abuse these drugs to increase alertness, suppress appetite for weight loss purposes, or to achieve a euphoric state. In some cases, people might amplify the drug's effect by consuming it in higher doses. Engaging in such practices can lead to severe adverse effects, including elevated body temperature, rapid heart rate, elevated blood pressure, episodes of panic, violent behavior, seizures, extreme suspicion, paranoia, or even psychosis, which is characterized by losing touch with reality. Coming to non-stimulants, they are used when stimulants are ineffective or cause side effects. Non-stimulant medications usually take a while to start working, so it could be several weeks before you feel the full effects. Also, they may not work as well as stimulants. Atomoxetine or Strattera and viloxazine or Qelbree belong to a class of antidepressants called selective norepinephrine reuptake inhibitors or SNRIs. They increase norepinephrine and serotonin levels in the brain and also are used for co-occurring anxiety or depression. Clonidine or Capvay and guanfacine or Intuniv were originally high blood pressure medications. They help with hyperactivity and impulsivity. However, they may not help as much in improving attention and focus. Other antidepressants. They are not primarily approved for ADHD but can be effective, especially in cases with coexisting mood disorders. Bupropion or Wellbutrin is an antidepressant which comes under norepinephrine and dopamine reuptake inhibitors or NDRIs. It works by increasing neurotransmitters norepinephrine and dopamine in your brain, which can help you improve your ability to concentrate. Tricyclic antidepressants like imipramine and nortriptyline, which are an older class, may be sometimes used as a last resort due to their side effects. Each medication comes with its own set of potential side effects and considerations. The choice of medication depends on individual symptoms, response to the treatment, and any coexisting conditions. ADHD treatment often involves a multimodal approach, combining medication with therapy, behavioral changes, and skills training. Treatment without medications for ADHD. Counseling and psychotherapy, particularly cognitive behavior therapy, can help deal with everyday life challenges for those with ADHD. In addition to talking with your healthcare provider about managing ADHD with medication, there are many techniques you can use to feel in control of your life. These strategies will take some work, and it will be important for you to decide which ones work best for you. It will take commitment for these strategies, but it might improve your overall quality of life. Maintaining organization in your home and workplace can be a significant obstacle for people with ADHD. Decluttering is a good starting point as it makes organizing easier. Starting with the easiest room or space first can help break this tedious process into small, manageable chunks. Before organizing, ensure that you have all the necessary supplies. Grouping similar items or those that correspond to an activity makes finding things and putting things away much easier. A designated spot for daily essentials by the door, such as keys, wallets, backpacks, reduces the time looking for them. Developing time management skills is essential for managing ADHD. There are various ways for that, and it is essential to experiment and find out what works best for you. A planner or a mobile app or a notebook can be used to write down all your appointments, meetings, and other commitments. Overestimating how long it will take to complete a task by adding at least 10 minutes is also helpful. Being aware of the clock will help you track the time, and using a simple watch instead of checking your phone will reduce the distractions. Making a scheduled routine helps you stay organized, on time, and on task. Checklists can also be helpful when creating routines. Organization is not only about arranging your physical space. People with ADHD also find it hard to go about tasks for school and work. Creating a list of daily tasks after checking your planner and prioritizing them will be helpful. When prioritizing, consider which tasks are the most important, which tasks are time sensitive, and which can be finished later. Keeping these lists in one notebook or app allows you to refer to previous lists to ensure that you don't forget any. Focusing on one task at a time ensures that you complete one task 100% instead of 5 tasks at 50%, thereby increasing the productivity. Money management. Procrastination, disorganization, and impulsivity can make money management a nightmare for adults with ADHD. Taking a proactive role is key to staying on track. Utilizing calendar reminders when bills and payments are due is helpful. Online banking can provide immediate access to financial information, and specialized smartphone apps can be used to track spending and maintain financial records. Driving. Distracted driving is a serious problem for all people, but it can be particularly dangerous for adults with ADHD. When driving, be aware of how inattentiveness and distractions will affect you. It is very important to reduce all possible distractions, especially cell phones. Texting and driving is illegal and also extremely dangerous. So be sure to turn off all notifications on phones before you are on your way out. A combination of counseling, medications, and creating structure in your life can improve your ability to manage your ADHD symptoms. But be realistic. This won't change overnight, but trying each day will help you build habits and coping strategies. Adult ADHD can be a lifelong disorder, but it doesn't have to affect the quality of your life.